In this video, we're going to go over a taping technique for fat pad syndrome. So just a quick little exam thing that you can do to identify fat pad syndrome. When you poke at the bottom part of the heel, just try to find right in the center of the heel bone, press in. Usually that elicits pretty sharp pain or pretty intense pain in that part of the heel. And then if you take your other hand and you push on the sides, what this does is it pushes the fat pad on the bottom of the heel together, so it reinforces the padding. And then when you press in again, it usually feels a lot better and takes away that sharper pain or takes away that pain the patient's feeling. So what you can do to help recover from fat pad, because fat pad syndrome, you really just need to let it rest and bolster it up with different padding, softer shoes, don't walk around barefoot, things like that. But a taping technique can be very helpful. So this is using some rock tape. So what I'm going to do is get this first piece here, and I'm going to put it right around the heel bone, starting from the back. Don't need any stretch or anything with this one. This is just to go around the sides of the heels in an attempt just to kind of keep that fat pad on the sides a little bit more, or from coming up the sides. Now with this longer strip, I want to do about 6 inches or so. And the idea is that you're going to anchor the tape, no stretch at all. Then get the paper off. And again, make sure that that's nice and pressed down. So now you're going to pull the tape to about 100% stretch, let it come back just a little bit, and then you're going to make sure it's sticking down. And on this back half of the heel, you're going to use this other hand to push the fat pad towards the center of the heel while you're applying the tape across the bottom over to the other side, and then anchor it down on this side with no stretch coming up. And then just rub it down to make sure it sticks real good. Then you're going to do the opposite. So then you're going to have the same length strap or piece of tape, and you're going to anchor it down. And this time you're going to pull the tape more towards the front half of the heel and push that fat pad towards the center, and then coming up, anchoring it down on the other side. So pretty simple taping technique, but again, the idea is that you, with one of the straps, you push the fat pad this way, the other one you put it that way, so that then it centralizes the fat pad where that painful spot is on the heel. And that should help quite a bit with the symptoms while it heals up.